thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we're welcomed by Dr. Todd Otten and Joshua Judy, and they are a doctor-patient duo who have co-authored the book Ripple of Change. Thank you both so much for being here. Why don't we start by you guys telling us, how did you get connected and what is this mission that you're on?
Joshua and I have been connected for quite some time. I was actually his primary care provider for the better part of 13 years. And as I was coming out of my burnout, I started to write as part of the catharsis. And the first thing I wrote was a poem called Medicine is a World of Gray, which is a dark poem, but gives a lot of reality of what's going on. Then I wrote a book, excuse me, not a book, rather a chapter called Anatomy of Burnout, which really gave a raw walk through what really happens to physicians when they're struggling and those nerves are frayed and their energy is drained and they're frustrated and they're not giving their best, not only to themselves, but also, unfortunately, to their patients and their families. And it was when I started writing that Joshua got involved. He had been struggling with his health as a result of the medicine that I had written for him. And I was running out of ideas, quite frankly. It was frustrating for both of us. And so I kind of gave him an idea what I was doing with the book. And my prescription was, and I'll let Joshua chime in here.
He didn't give me a ton to go on. He asked me to just write. Write what? And I didn't get much guidance beyond that. But I think that was there was a lot of power in the simplicity of that, right? So it gave me the freedom, I think, to finally open up and put my thoughts down and pour my heart out and, open my soul to what was going on. And through that, I was able to get to a much better place. And through that journey with Todd, he did as well. We came out better on the other side, and here we are, still fighting the good fight and trying to make healthcare a better place for everyone.
Todd, you mentioned that you said he was having health issues as a result of something that you prescribed him. So what was that? How did you guys realize that issue and come together? And still, I think sometimes there can be animosity if there's an issue and you realize that something happens and it was maybe a mistake or maybe something that wasn't cut. So how did you guys realize what happened and then decide to work collaboratively?
For sure. So the interesting part of it was I still take actually the exact same medication at the exact same dose that I had written for Joshua. I take it for post-concussive headaches and neuropathic pain. And Joshua was having cervical radicular pain, and so we were taking a similar type of approach. Unfortunately, he had a lot of side effects right away, and then it really got bad after he had come off of it with the withdrawal syndrome. And a big part of when I was seeing patients, I was honest, I was transparent. I realized that a problem had occurred and I owned it. I didn't run from it. That wasn't the right thing to do. The right thing to do was to try my best. And we did. It got frustrating for the both of us. And that, fortunately, the writing piece of it just made a huge difference.
Yeah, and if I could just add to that, I mean, I think patients want to see themselves sometimes in their doctors. And, from a relatability standpoint, Todd was always open, but so much more came out through the writing process. One thing that I didn't realize was that Todd was suffering with post-concussive pain. For a while, I didn't realize he was on the same medication. And so a lot of the theme in the book is about putting yourself in other people's shoes. And this was a vehicle for us to do that. And it's just one thing I think to keep in mind is that everybody's sensitivity, right, is different to medications. It can be the same medication with wildly different outcomes. And so just to have that understanding and empathy, that everybody knows their body the best. And that's something that came out through our journeys collectively.
It's a really interesting journey that you're laying out. Hard to believe that a doctor and patient can kind of get to that place. And actually, one thing that really is intriguing me is what you're both describing as a writing journey. So was it, maybe you can dig into that a little bit more? Was it both of you just writing independently? Was it writing to each other? Was it writing and sharing with the public? What made it so therapeutic? And did it involve anything more than writing at any point, or was it purely the writing? I'd love to understand how that therapy worked.
All of the above, really. We used a process where we'd often surprise each other with a piece that we would write. We're and playing on this yin yang theme. I'm often a night owl, and Todd's much more of a morning person. So I would write something at night, craft it, and I'd give him basically the gift of that the following morning when he'd wake up and was drinking his coffee. And then, it just swelled from there. We'd bounce each ideas off of one another. And then what was nice, we could do this remotely to the benefit of our own schedules. And then we'd often get together for brainstorming sessions. And then we pulled in friends, family, and others. And that's so much, I think, plays to the Ripple theme, right? We want this to be an inclusive collective process. And that's exactly how we wrote the book, too.
And to add to that, the yin and yang approach was just amazing, and it almost became intuitive after a while. Google Docs was very much our best friend for this, because we could make some comments within the context of a chapter and tag one another with it. But it started to go way beyond that. The initial audience for the book was physicians and administrators, to try and bridge that gap that often exists, unfortunately, within the healthcare space. And then when Joshua got involved, the target audience became the American healthcare consumer, which clearly that affects all of us. And so we started pulling in all kinds of voices: architects, CEOs, military officers, lawyers, other physicians, nurses. And some of the pieces are actually written by some of these individuals. So you get this really broad scope of a lot of the issues in healthcare, but more importantly, just many, many ideas of little nuggets and tools you could take, whether it's on a small scale or whether it's on a much larger scale, so that we can all play our part to improve, the existing infrastructure.
Excellent. It seems like the ripples of change has started with you, right? Internally, the both of you together, bouncing things off of each other. And I guess, is that where the idea came from, that that's what you wanted to do? At what point did you realize that what you were really trying to create is ripples of change? And I'd love to hear some more examples of how those ripples started to impact other people. Maybe, kind of like, how did that start spreading?
I'll start on this one. Initially, I was somewhat adamant that we needed to have our quadruple aim, or the quadruple aim, as part of the title. And Josh was just as adamant that we needed to go in a different direction for the title, because he's like, no one's going to know what you're talking about. And I'm like, okay, that makes a lot of sense. And so then I don't remember who exactly came up with the ripple of change, but the reality was, we realized that everybody can play their part by throwing a small pebble in. Some of us, such as myself, tend to throw rocks or potentially boulders at times. So that's how it evolved, and I'll let Josh piggyback on that. But before I do that, one definite instance of this is at the institution I worked at most recently. One of the medical leaders has definitely been energized by the reading and then some of the things on the podcast. And through the grapevine, I've heard that he started using the term positive disruptor, which I borrowed from Dr. David Beaumont. And so that's just a small example, right? There's definitely things brewing at a much larger scale. For instance, with Medicine Forward, we just did a town hall last week with Dr. Charbonneau from Indiana University and the Good Trouble Coalition. And so all these dots are starting to connect, and you can just feel the energy when you get in the room. It's just amazing.
Yeah, absolutely. And just to tug on that string a little bit more about the ripple, so much of that comes from the power of one, but realizing the ability of one person to make a big change. Because we talk about the sphere of control, right? So when I was struggling with my health, Todd had written about how he wanted to grow his influence and sphere of control with me to get me to a better spot. And, sometimes you just have to be courageous and take that first step and throw that that proverbial pebble, and realize that you are empowered to make changes. And sometimes that just starts with asking the right questions. There's actually a quote in the book. I think that would frame things up really nicely. It's actually in Todd's chapter called Ripple Change, Chapter 9. And it's from the Dalai Lama. And it says, just as ripples spread out, when a single pebble is dropped into water, the actions of individuals can have far reaching effects. And we're really starting to see that, with all the folks, the amazing folks that we're connecting with that want this positive change, this positive disruption in healthcare. So, I mean, it's just been an amazing thing.
What are some of those things that you've seen people really grab onto that are making the difference? Because sometimes things, budget get in the way, or, red tape. So what are some of the things that these people can do if they just want to be their own pebble? And have you seen any organizations that have said, yeah, let's do it. Let's take the boulder and as an organization? What's that reception been like?
So I think from an individual basis, there are many, many ideas throughout the book that speak to this, but perhaps the one that's the simplest is in a chapter called ROI for a Health System. And we offer 10 challenges that are either low cost or no cost, which is probably music to a CFO's ears, I suppose, for doing things. And one of the challenges is just kindness and kudos. And that is so easy, but the return is so high if you do it right. Um, to the latter half of the question, I wouldn't say that we're at the stage where we've started to see the impact from other institutions. If I rewind the clock, I've absolutely seen the impact, whether it was at the office I worked at, which we dubbed the Office Utopia in the book, whether it was at the Critical Access Rural Hospital where I was chief of staff. When we preached the Quadruple Aim at the time, and now our Quadruple Aim, it was amazing. People wanted to be there. Retention was high, and patients wanted to be there too. You don't have to spend a lot of money on marketing. You just need to treat people well, and they're going to want to come back and be customers, clients, patients, however you want to frame it, for life. And I also saw it at the ACO level when I was a medical director. And, so those are three tiers in my own experience where I've seen what we talk about work. And what we want to do is we want to shout this idea out to the world and let people take it and run with it.
Yeah, and I'd like to build on that too. So Todd spoke a lot from the healthcare space, right? But the concepts within Ripple of Change are applicable beyond healthcare. So when you think about the patient experience of our Quadruple Aim, quality care, right, lower cost, and provider wellness, that can easily be translated to the business world, to everyday interactions, right, through better customer service, employee happiness. You're going to get lower costs because you're going to have higher retention rates, right, and focus on quality and balancing that in as well. So I see it every day in my own work environment, applying some of these basic principles on my own team and giving them kindness and kudos and watching them go the extra mile. You have to give that respect if you want to give it back. And so I'm applying it in my everyday life as well.
So something with really far-reaching implications, it seems like, and yet it's just a small ripple. So that's the amazing thing about it. I'm fascinated by what both of you are saying. It actually reminds me a little bit about one of our guests who we had maybe a couple of years back, Larry McAvoy. Who's also a physician, emergency room physician, and he, was a CEO of a health system in Colorado. What he talks about, he wrote a book called Epidemic Leadership, and what he talks about is the power of social contagion and how you create environments within where you can get the social contagion to spread. So connecting that idea back to the ripple theme, which I find really equally fascinating, is what do you think it is within that ripple that's actually spreading, right? Because it's obviously not a physical ripple as you get in a lake and you can understand it, the physics of it. But here we're talking about ripples across humans or across human structures. And so do you have a sense of what that is actually spreading in that ripple?
I think in its infancy, I would say it's positive energy is what I'm feeling. And it's amazing. The power of positivity is understated and is desperately needed in so many facets of our world right now. Um, that would be what I would say. 2 words: positive energy.
Awesome.
I would
Joshua, yeah. And
Yeah.
earlier I would pull it a little bit more and say, because earlier I think it was you, Todd, who mentioned compassion and love, and of course, as you know, that's a theme that Stephanie and I really enjoy talking about. So can you comment a little bit on how you see that potentially spreading as well? Is that just a subset of positive energy or another component of it?
I think I think it's very much a driver. Approve. I mean, ripple of change is very much a roadmap or mindset, if you will, right? And you can look at things, it depends on how you see the world, right? If you see it half full, if it's Todd, he probably sees the world most of the time 3/4 full, right? And so if you're leading with that positive foot, I mean, people want to get behind you. They feel it, right? And they want to help you make those changes. So, I mean, I think it's a key component of leadership is when you're facing adversity or challenges, you sit back and reflect, okay, how can we be calm, confident, and caring in these situations? And people will resonate with that, and they'll grab onto it.
And when I'm throwing perhaps boulders at times, there's components of love, empathy, compassion, connectivity, positive energy, all kinds of stuff mixed in there. And it depends on the situation, right? Not everything's the same. And not every instance is the same. Sometimes it's just sharing knowledge. Sometimes it's encouraging people to say no. I've talked with many of my colleagues, and the thing that I've shared is when I'm hearing the frustrations they have and the inappropriate things that are coming down the pipeline, I challenge them. I say, "Have you said no?" And well, I can't. And then I say, "Why not? Why can't you? What's going to happen? You're a physician. You can get a job anywhere. You can say no, and that is okay." Um, and sometimes it's the right thing to do.
That does sound hard. It's tough when you're in any sort of position because you are, especially in a physician position, probably, encumbered by golden handcuffs in a lot of ways, right? And you're afraid what happens, and you're already feeling stressed and then thinking like, oh my God, I'm going to have to go look for a new job. That probably sounds like a burden too, which maybe lends itself to my next question, that you said that you were suffering extreme burnout for quite a period of time and, had a dark place because we're in a dark place because of it. But then some of these strategies and this new method that you embraced really are what pulled you out of that and allowed you to go on and form relationships with people like Joshua. So what are those things that you guys are trying to spread the word about? What are those pebbles that you're throwing out there that people can realize that this really is something? You said you have a chapter that's the CFO's dream, basically. But what are those things? How is this going to embrace, our quadruple aim? How is that going to lead to physicians pulling themselves out of those places and patients finding themselves in a position of hope rather than despair or desperation?
When I came out of burnout, to answer the question, I vowed I was never going to get burned out again. I said, I'm not going to go down that path again. It doesn't matter what it takes. I'm not going there. And so I made a concerted effort at our clinic to live, at the time, the quadruple aim. So again, patient experience, quality care, lower costs, provider well-being. And our office was incredible. We had 3 nurse practitioners and myself, so 4 clinicians, and we only had 6 exam rooms. That in and of itself is a recipe for disaster if you don't deal with that. But we talked about it. We offset schedules a little bit. We had evening hours. Some people would do virtual visits one day. So we made it work. And there were lots of conversations that went that way. And the big takeaway for a clinician or a physician or a nurse or whoever, you can take the quadruple aim and use it as your lens for when you're making decisions or talking with administrators. And if the conversation is, oh, we're going to save this amount of money by only giving you 6 exam rooms, the response should be, well, that's going to negatively impact quality. That's going to negatively impact well-being, which is going to hurt retention. And oh, by the way, we're probably going to waste a lot of money in the meantime, just trying to make up for all the inefficiencies we've created. So when you take that lens, and that's your defense or shield or armor or whatever you want to call it, you can morph it into just a really good discussion of what is the right answer in this situation. So that's what I would offer as my number one tip. Take that tool, learn about it a little bit, and then when issues come up, dissect it a little bit.
Yeah, I think that's well said, Todd. And I'd love to offer a bit of the perspective from the patient side. So one thing that I wanted to be able to share with the audience is that there's the ability to be an advocate for yourself. And I think I highlighted this earlier. You know your body better than anybody, right? So sometimes you have to dig in and do the research. It's important not to give up. Sometimes you have to go and find out. Maybe there's a substitute for a medication. You can't just rely on your doctor because oftentimes they're constrained by the number of appointments they have and throughput, right? So you get that 15 minutes only with your physician. You got to make the most of your time. So it's important to do some of that prep work. And I wanted to be able to offer these practical, very tangible tips. So there's a section in the book, often followed at the end of each chapter, called Too Long Didn't Read. So if you want to distill down some of those tips and tricks that you can go and arm yourself with when you go in for your next visit, they're there. And those were very hard earned, sometimes painfully earned and learned, things that I encountered, or my wife's journey is also Megan, who also helped with a lot of the editing in the book. She offers, her perspective as well. And so our voices come through that. And I think any patient that reads that is going to find a lot of value in that. And of course, I wrote it through the lens of our quadruple aim. So
I want to kind of continue down the thread that both of you were just talking about in terms of our quadruple aim. You described it earlier, and Joshua, when you were talking, I was wondering, does the quadruple aim translate well to patients? Do they get it? Do they understand how to use it? Is it meant for them to use as a tool as well to frame conversations? Do you help train them in it potentially? And then with Todd on this final question, relatedly, I want to know, you were framing out conversations with, I was thinking, C-suite executives and using the quadruple aim. How do those conversations go? Do you feel like you've had a better outcome, or at least a better discussion as a result of using the quadruple aim frame?
From the patient perspective, absolutely. And I would offer this. Think of it this way. This might be the easiest way to say it. If your doctor or your nurse practitioner is doing well, they're going to provide you the best care. You're going to get the best patient experience. You're going to get high quality care, and it's probably going to be done at an affordable cost. So I think that's really easy, understanding that your provider is a person as well. They're human. They have struggles. They might be, going up against the challenge of their own health issues, like I found out Todd was. And I think everybody can relate to that, right? It's very, very simple. It's very simple and brilliant, and a way to apply that. I think if you can take that mindset forward, you'll do just fine.
And I've seen both ends of the spectrum in terms of interacting with the C-suite regarding the quadruple aim or quadruple aim. At its best, it is genius. It works tremendously well. There has to be that ability to listen. There has to be that, receptiveness there, and people need to be moving towards aligned incentives and on the same page. I make the analogy in the book, if someone's, rowing on the port side in one direction and on the starboard side in the other direction, you're just going in circles, right? And I've been in that scenario too. And that's typically when the focus is on money. When there's a myopic view on the ROI and how much are we going to make from this, the wheels just kind of fall off the bus, and it's sad because it could so go the other way.
Thank you guys both for being here and for sharing your perspective on this. It's a fascinating journey that you've both been on.
Thanks for having us.
Absolutely. It's been a pleasure. Thank you.
Thank you. I'm looking forward to trying to keep these ripples going as well. Thank you for educating us about that.
And thank you all for watching. We'll talk to you soon. Bye-bye.